So now I think we're going to do the comparative effectiveness research session, and Pam Knight is going to lead that one.
Hi, everybody. What is comparative effectiveness research? It's something that's going to become more and more important in NF as treatments are developed, and we have not just one effective treatment for a different, for a given manifestation, but a choice. And we have to be ready to analyze and make decisions alongside with the doctors. So what it is direct comparison of two or more existing treatments. So the way that clinical research is often done is testing, say, a drug against no drug, and seeing if a drug is effective, and then if it is, hopefully it gets approved and used. But what about the second drug that comes out? It's also approved, it's also considered safe and effective, and then you as a patient or parent need to compare the two and see which is best for you. There probably wouldn't be a clinical trial done again comparing the two head to head, so we have to look at other ways to make our decisions. As it says on the slide, the first question is, does it work? But then CER goes on to say, does it work better than that, especially for an individual? Because, everything works different for different people. So this is where patients come into it, working with their doctors. So just a quick background. As you know, this meeting is sponsored by PCORI, Patient Centers Outcome Research Institute. And PCORI is very interested in doing these sorts of practical studies that are going to have real-world implications. They've committed $2 billion to funding these sorts of studies and building information systems that will help you compare two approved or more than two approved treatments, and also being able to communicate this back to patients. So the main point of CER is to be very practical and useful and basically help people make informed decisions about their health care. When there are different options, you need sort of a format and a framework to help you think about it. And this is what CER tries to provide. So there are many different definitions of CER in different contexts, but for PCORI, it's consulting in concert with all the stakeholders to find out, what are the outcomes that are most important to people? What are the values and preferences that have to be considered when you're making these decisions? And how you can help people grasp and process the benefits and harms, especially in an individual way. So just a quote from PCORI: when the aim of research is to inform decision makers, listen to the decision makers, who are you guys. Decisions made together with patient and doctor. They've done studies that show that they prevent errors, they improve outcomes. People feel more comfortable afterwards with their decisions when they've made it in a very methodical way. And it's especially with individual treatment, it's something that has to be done on an individual basis. So to enable these decisions, decision aids have been created. PCORI has funded lots of these. They are structured to help people, especially in high-pressure situations, sort out their options. There was one I read about where parents whose kids were in an ER for a concussion were given an instrument to help them decide whether the kid should have an MRI or a CT or just go home and be observed. And, of course, the parents at that point are very emotional and just having, a piece of paper with options laid out kind of helps, I think, not take away the emotionality, but distract from it so that, your logical brain is engaged and you can make a decision that you'll be comfortable with later. Decision trees are another decision aid that's been used in business for years, where you map out the decisions, but also assign a utility, which could just be like a number from 1 to 10, like what's most important to you. It's just another way of putting something down on paper that helps you really see your decision and make the one that you're going to be happier with in the long term. Answering questions like, am I willing to risk this to possibly get that, or is the risk not something I'm comfortable with? So people that use these decision aids feel better, and they take a more active role, they have more accurate risk perceptions, they're able to communicate their preferences, and they feel less conflicted because they feel like they've made a rational, reasoned choice. And they're less likely to say, just let the doctor decide, because more and more, you need to be an active partner. So one study, just as an example of what a CER study can be, it found that women over 50 with breast cancer in one breast, but did not have any of the predisposition genes, the BRCA genes. They had similar life expectancies if they decided to get the unaffected breast also surgically removed at the same time. It didn't really improve their outcomes. So that is a piece of information that was derived from CER that's actually been helpful in helping people make decisions. Another one was comparing childhood anxiety disorder medications, and found that a combination with meds and therapy was better than either treatment alone. So that's another choice point that this kind of information can help. Just to briefly talk about the methods, there are randomized trials, which were the head-to-head comparisons, like what Dr. Shorey was talking about with the bone morphogenic protein versus traditional therapy. There's also observational research, which, especially in a rare disease where it's hard to get a lot, a big population together in one trial, it's easier if it's an observational trial. And a lot of PCORI research has been observational. Also decision analysis, just kind of figuring out what psychological processes people go through when they make decisions and trying to work with them and accommodate them. So how's CER done? Say there's an existing treatment and then we have new treatments. How are we going to compare them all? As I said, there's probably not going to be a big funded experimental double-blind study comparing all 3 of these treatments. So the way it's often done is by a literature search, where you just see everything that's out there that's published, and if there are enough things in common with the methods, you can compare the results. If not, you can almost just look at all the different studies and try to just see which ones are high enough quality to be included in your analysis, and combine them if you can. So in rare disease, it's a special challenge to do CER. Recruiting enough for one study is hard. Recruiting for second and third studies even harder. That's why some of the things that CTF tries to do is important, because we can combine and collaborate and get different groups to use the same outcome measures, which is a lot of what RAINS is trying to do, so that you can compare study to study. So right now, we sometimes don't even have one treatment choice, but it's really coming along, and I see that I would expect that there's going to be, choice points in the future where you can say, well, do I want to try this MEK inhibitor or a different MEK inhibitor? And that's why patient engagement and patient training is so important, because that's how these decisions are going to be made with patient input. So we really feel like this is the way forward. We're getting in on the ground floor. We can't really do the CER, but we're all going to be trained and ready when it becomes possible, which won't be that far off, I don't think. So the next two speakers are going to talk about some practical applications of CER. First, Dr. Betty Shorey, who we just heard from, and she already talked about parent choice in this new trial she's doing. So I think she's going to go into a little bit more detail on how she supports that parent choice. Okay. Oh, and I'm sorry, and following Dr. Shorey, Dr. Welling, who's professor and chair of Harvard Department of Otolaryngology and chief of otolaryngology at Massachusetts Eye and Ear Infirmary and Mass General, who has the job of talking with NF2 patients about their various options for surgery or medical treatment or types of surgery, and he's going to talk about how he helps patients decide between their different options.